everyone. Myself, Dr. Sahil Gupta from IAFA Ayurveda. Today I am live, so I want to discuss with mothers directly whose childs are having allergies and they are having concern about their child immune health and allergies. So mothers ask me a lot of questions during consultation time, and I feel that some questions deserves a detailed answer. So that's why today I am live and I prepared notes already so that I can share with you, and I am not going to miss any important point so that the visiting mothers can get the benefit, or I can able to express my knowledge with them. So today in the morning I had a great conversation with a mom residing in Virginia, USA. Her 3-year-old kid is suffering from food allergies and atopic march. So she asked a very important question that, doctor, I had done breast pump milk, and will be the main reason in my child allergies and other concerns. So I feel that this is a very important question, and maybe many mothers are having such kinds of doubts in their mind and cannot able to do conversation or discussion at the level of consultations, and sometimes such questions miss by my side also. So right now in this live session I am going to discuss with you about the consequences of breast pump bottle feed. Other than that, what Ayurveda says about stanpan and what are the better options. Everything we will discuss in this live session. So already I had told you that I had mentioned a notes so that I will not miss any points, because during live in front of camera sometimes I also miss some important points. So one by one we will discuss each and everything. If you have any questions, then you can post in the comments. I will answer later on regarding your child health and allergies. So now, first of all, we are going to discuss that what Ayurveda says about first milk, means stanne. So Ayurveda says that it is amrit. It builds ojas. Ojas means immunity, nourish tissues, and creates a strong foundation of immunity. So it's very important for a child. Okay, and what modern science also confirms that exclusive breastfeeding for at least 6 months, along with continued breastfeeding for 2 years, provide balanced nutrition to your child as well as development of a healthy gut microbiome along with strong immune system. So I always recommend to each and every mother, kindly follow these principles. And even we are replacing natural breastfeeding too early, means if any mother is replacing that with bottle, so you think about that, the bottle feed, whether it is formula or whether it is breast pump, so we are going against nature. So exposing children to the avoidable factors, means these factors we can avoid but we are going to intake. So we are giving a call to allergies and asthma itself. So right now the second major thing, like the risk factors of bottle or breast pump bottle feed when you are giving to your child, one by one I will explain you the risk factors. First is microplastic exposures from bottles as well as the storage containers. Okay, and the second is the detergent residue. So you are going to wash it several times, and surely there will be detergent residue that you are going to introduce to your child from day one. And the third one is refrigerated or stored milk, means it loses the vitality and nature of the milk, means the immune properties that is already present in the milk that you are losing by refrigerating it. And the fourth point is there is a higher possibility of microbial overgrowth, means in stored milk. It increases the risk factors, means infections, okay, to your child. So this will alter the immunity, and surely there will be chances of having allergies, okay, asthma, eczema, okay, atopic march, food allergy. So better to avoid. So I'm I am I am not against this situation strictly. Many working women have no options other than this. So my intention is not to blame you. My goal is to build awareness so that wherever it is possible, we can return to the nature, closer to the nature. Kindly think about the nature, learn from the nature. The mammals on this earth, they have no options other than the stanpan, means other than the breastfeeding to their, you can say that, newborns. So they are already following the principle of nature, and earth is designed like this. They are nourishing their newborns. So you think about that, even they are not getting the vaccination, and they are not, you can say that, getting some or such kinds of issues on, you can say that, higher scale. Nowadays, if you find out the epidemiology of food allergies in every country, so there is skyrocketing graph. So you think about that, we are going far away from nature. That's why the children are indulging in such kinds of disorders. So it's very important for your child health for first 2 years of life, and that will never came back. Okay, so give priority to your child born and brought up phase. So dedicate your 2 years for natural nourishments and upbringing. Okay, so now I am coming to the point that balanced guidance for working mothers, means it's very challenging for the working mothers also, that how it is possible for breastfeed every time when there is no options. So always use glass bottle instead of microplastic or plastic bottles. Okay, and avoid strong detergent. Use plant based very mild detergents, and try to wash it immediately, so that most probably there will be lesser needs of detergents or mild detergents even. And if it is possible, then kindly give fresh milk, expressed milk, okay, whenever it is possible. Okay, and maintain strict hygiene to prevent microbial overgrowth. Okay, so these are the major points that you have to follow if you are working. And again, I am going to tell you that direct breastfeeding is the gold standard. Okay, pumped milk is still better than formula, but always try to minimize risk. Okay, so now I am going to explain about the stannapan, means the breastfeed in Ayurveda. It is termed as stannapan. So is not just food; it's immune programming for life. Means what you are going to give, or what you are going, your child is deserving that his or her immune programming is going on in first 2 years. So this is very important. This stannapan is very important. The milk that is termed as ras dhatu, the mother's milk. So directly if the child consume, nothing is better than this nourishment. Okay, this milk, and gives a complete balanced nutrition to the child. So always give your child a complete nourishment or a complete diet. If mothers eat always a balanced diet, or maintain the digestion, maintain the proper food combination, means not following the viruddha ahar, eating the satamya ahar, that the food is compatible for her health, and not even taking the more preserved processed or foods contains with artificial colors, sweeteners, something like that. Then it also helps to maintain the gut microbiome healthy and boost the immunity. Okay, and whenever required, as maximum as possible, kindly shift on the breastfeeding. So to the all watching mothers, breastfeeding is nature most perfect gift for your child. Exclusive breastfeeding up to 6 months and continue to 2 years of age always prevent allergies, build immunity, and ensures balanced growth of your child. If your child is facing any kind of allergies or health concerns or recurrent infections, Ayurveda is the safest way. We can choose the plant based treatment or remedies, natural solution to strengthen their gut. So we are always here. I am always here. You can book your consultations on IFA Ayurveda official website www.iafaforallergy.com, or you can WhatsApp us on +919612180000 with each and every concern. I will try to best my knowledge, and whatever else will be your questions, you can also mention in the pinned comment. So I am ending this live session. I will try to come again with such kinds of questions that mothers ask during the consultation time. If it is important and I have to be discussed on the you can say that social media platform, then definitely I will discuss in next upcoming live. Thanks a lot. Goodbye. Have a nice day.